Hello, hello, it's Bill, the knee pain guru. Today is Monday, March 21st, 2022. Welcome, welcome. Today, let's see, we're going to dig into, is surgery the only way for bone-on-bone arthritis? Okay. We're going to talk about that in just a moment. If you have questions, type those in the live chat. We will dig into whatever situation you have going on with your knees, whatever questions you have regarding knees, knee pain, etc., etc. And make sure to give the video a thumbs up, like and subscribe to the channel. Turn on notifications for future videos. And because I use those, the whatever topics that your subjects, what comments, questions. If you're not live on this call, we do those for future videos. We use those as topics for future videos. So if you do have questions, please type those in the live chat or the comment section. I will get those and we will dig in. Okay. Today we're going to talk about, is surgery the only way for bone-on-bone arthritis? And the question here is from James Paul. It says, so I have bone-on-bone, right knee that now has shifted, so it's no longer flush bone-on-bone. I'm very open-minded to my body being able to heal itself. However, I need your guidance. Have a consultation with an orthopedic surgeon at the end of the month. However, I'm not sold on the idea of having surgery. I'd like to hear what I can do instead of surgery. Excellent. Well, there's actually lots of things you can do. And Suzanne writes, hi, Bill. I'm very excited for this live chat. Thank you. Yeah, you're very welcome. That's what they're for. This is these videos, and just so we're clear, and we'll dig into James Paul's situation in just a moment, these videos are not for giving you like the step-by-step solution for what's going on with your knees, because every knee pain is different. Situation with James that's bone-on-bone arthritis is going to be different than someone struggling with chondromalacia, than someone struggling with pain after an ACL reconstruction or a meniscus surgery or whatever it is. Every situation with knee pain is different. The knee can hurt in different places, the front of the knee, the back of the knee, the inside of the knee, the outside of the knee. So these videos are designed to begin to shift your mindset in a way to understand how your body can heal itself. That if we're looking for a solution strictly from the Western medical model, which is drug, shots, surgery, physical therapy, we're going to be very limited as far as what we're able to do in terms of healing the body. So when we open our mind up to different possibilities, now we can see, oh, well, if I go to physical therapy and work with this in conjunction to physical therapy, I could get more results in a shorter period of time. Or I could use the PRP injection or the rooster comb injection or the cortisone shot as a short-term strategy to build in with a longer-term strategy of how I can get my knee out of pain. Or in James's situation, I have arthritis and bone-on-bone. And the doctor is telling me that the only way out of this is a knee replacement surgery. What else can I do? So we look at different strategies on how we can get your knees to start feeling less painful and increase the comfortable range of motion in the knee. When we begin doing that, now the body begins to become hopeful because it's feeling different. We're moving in a different direction. Okay, here we go. If this information is making sense, give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. Okay, let me see here. We have some comments. Okay, we're going to get into the question here from James. So all diagnosis of arthritis, and you can check this with your doctor, you can check this with your physical therapist, all diagnosis of arthritis is dehydrated joint. Bottom line, end of story. Full stop. It's dehydrated joint. Well, why does that happen? Because the joint is supposed to have a certain amount of space in the joint. And when the joint gets painful from an accident, an injury, a surgery, a trauma, whatever happens, life happens, the joint tenses up to protect itself. Normal, natural response to an accident, an injury, a surgery, a trauma. And when that joint squeezes to protect itself, tension comes into the joint and it begins to squeeze out the synovial fluid in the joint. Well, the synovial fluid is lubrication that the joint needs in order to keep the joint bending and moving smoothly and properly. Well, when the joint gets dehydrated, that lubrication is no longer there. It makes the joint more painful, more stiff, more tight, which makes the joint squeeze more. And when the joint doesn't have, it squeezes more and it doesn't have the lubrication, it begins to wear. Now, for an afternoon or a short period of time, it's not a big deal. The joint will still function because, well, our bodies are quite resilient. But if we don't address these neurological patterns that get set in the joint as a result of the accident, the injury, the surgery, the trauma, then what ends up happening is the joint wears day after day, week after week, month after month, year after year, until we get to a place where it's bone on bone. And now the joint is severely dehydrated and it's worn down pretty well. We can begin to set up the conditions in your body to relubricate the joint. And it's more than just a function of drinking more water, although that's part of the equation. We have to make sure your body is able to absorb the water that it is drinking and that we reestablish the space in the joint. Reestablishing the space of the joint in the joint is part of the neurological re-education of getting the joint to relax and let go and unwind. So now the water that you are drinking can actually get into the joint. If this is making sense, give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. So if at any point in time, if I'm explaining something that doesn't make sense, ask the question. Say, hey, Bill, this doesn't make sense, because we need to break it down. That's how you get exponential results in what's going on with your knee, is that we take really basic, simple concepts and making into manageable bite-sized chunks. And each time you digest a manageable bite-sized chunk, that becomes part of you. You begin to integrate it. So now what we're talking about next week, next month, next year is completely different, because the body wants to heal. Your body wants not to be in pain. Your body wants to feel good. And when it is not feeling good, when there is pain, it's because there's something in the way, something that we're doing that is preventing your body from doing so. We just need to remove those blocks, those things that are causing your knees to ache, to be painful, to be stiff, to be sore, whatever that is. We need to begin to set up the conditions so that becomes less and less and less. And we do this very simple concepts, like drinking water is one of them. That was one of the pieces that I've had clients that have gotten completely out of pain just because they started drinking water. Now, sometimes you drink water, you're like, this happens a lot in my program, is that people will start drinking more water, but then they're like, oh, I got to go to the bathroom 5 minutes later. That's because your body's not absorbing the water. So we need to have a different strategy. We need to get your body to absorb the water. So now you're drinking the water, your body's absorbing the water. Now we need to create space in the joint. Well, how do we do that? By creating comfort. Well, how do we create comfort? Depends on where your knee hurts, because a person with pain in the kneecap is going to have a different position of comfort than a person who has a Baker cyst, pain in the back of the knee. We have to look at what is going on and customize a program that is going to begin to reestablish the space in your joint and set up the conditions so your body's going to be able to heal what's going on in your knees. And this is not physical therapy. This is not exercises. This is not stretching. This is something other than that. And what's important is the more we can create comfort in your knee and change the neurological signaling in your knee joint, the more your joint relaxes and space is created so it has an increased comfortable range of motion and the pain is reduced. If this is making sense, give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. Please type in your questions in the live chat and we'll address those. I'll make sure we don't get off the call today until all the questions are answered. So back to James's question about bone on bone and osteoarthritis. Osteoarthritis, once again, we'll go back, dehydrated joint. The joint's been dehydrated for an extended period of time. The joint begins to wear. It wears down the cartilage at the end of the bone. Eventually, it gets to be bone on bone, so the bones are rubbing. We can begin to create space in the joint by creating comfort and getting the body to absorb the water that you're drinking. And that begins to set up the conditions so now your body has the resources so the joint is lubricated. Everything they're trying to do, the Western medical model is trying to do in terms of injections into the joint to lubricate the joint. Cortisone injections, PRP injections, hyaluronic acid injections, rooster comb injections, stem cell injections. All of that is trying to get the healing components into the knee. And what ends up happening is a lot of people waste a lot of money with that, trying to get the knee to heal when there's not enough space in the joint for everything that the doctors are doing to be able to heal it. The joint's squeezing too tight. So we have to take a step back and look at the bigger picture of what's going on in the body to set up the conditions so the joint starts to feel more comfortable, and we set up the conditions so the body's able to heal itself. Okay, so that's going to apply. These principles that I'm speaking about are going to apply no matter what knee injury you've had, as long as nothing is broken or torn. And if something's broken or torn, we just have to take a different approach. You have to have a different strategy depending on your age, your activity level, what type of tear or what's going on in the knee, and then your goals, your outcomes, or what you're looking for. We want to manage expectations. And this is what happened. I worked with a client out of Nigeria. She was in Nigeria, and she had no faith in the medical the medical profession in her country. To have a surgery in her country was just not a good idea. So we worked with a torn meniscus and torn ACL based on what she was doing, and she got out of pain. Now, I'm not saying it's going to be across the board. It's possible. We just need to take that into consideration and know exactly what we're dealing with in order to develop that strategy to get you out of pain. Which is to say, make sure you go to your doctor, you get a diagnosis. Make sure you have an X-ray, a CT scan, and MRI so we know what we're dealing with. Because the strategy when something is broken or torn can be completely different than if nothing is broken or torn in the knee and you just have pain. You're just struggling with range of motion. So we want to make sure we're making the distinction between the two, that something is broken or torn, nothing is broken or torn, so we're not blindsided and you're not disappointed with the results you're getting because we don't know what we're dealing with. If that making sense, give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. Okay, and if this information sounds good, you can absolutely go to my website, thekneepainguru.com, and sign up for a complimentary membership to my Knee Club Lite program. The Knee Club program is the bigger program. Knee Club Lite is a stripped down version of it, so you can see how I work with clients. You can also give us a call and speak to one of our friendly team members, 877-891-9484. Okay. We have a question here from Suzanne. She writes, can I strengthen the muscles around the kneecap to strengthen it enough to avoid surgery? Strengthen the muscles around the kneecap. Suzanne, technically there are no muscles around the kneecap, and I will show you. But what is around the kneecap is a tendon. And strengthening tendons, ligaments, and fascia, which are in and around the joint itself, is completely different than strengthening muscles. So we want to be clear on what we're strengthening. We can go to an anatomy of the knee. Let's see. Let me bring this up for you. I'm going to share the image here, everybody. Okay, here we go. Here's a good picture. Let me share this picture with you about the anatomy of the knee. Share screen. There we go. Anatomy of the knee. Okay, so we have the anatomy of the knee. All of the stuff in red. Let me see if I can make this a little bigger. There we go. Okay, everything we're looking at in red is muscles. Here is a kneecap. And everything attaching to the kneecap is in this gray bluish color. Now, everything in gray bluish color is either right here it's a tendon. Here's a tendon, because tendons connect muscle to bone. Ligaments, these are the ligaments inside the knee. They connect bone to bone. You have this covering on the end of the bone, which is the cartilage. And it doesn't look like a meniscus is present in this knee, but you get an idea here that there aren't actually muscles. Here, let me stop this sharing. Stop sharing. Okay. There aren't muscles in the knee. So if you're working really hard to strengthen the muscles in the knee, it's not going to work because, one, there are no muscles in the knee. Two, strengthening tendons, ligaments, and fascia is like apples and oranges to strengthening muscles. So we want to make sure we're clear about what we're strengthening and how we're strengthening it. That's first and foremost. Then we need to ask more questions here, Suzanne, as far as like muscles around the kneecap to strengthen it to avoid surgery. What surgery? Like, is it meniscus surgery? There are different reasons someone would have surgery, and strengthening the muscles doesn't necessarily mean whatever you're struggling with the knee is going to be solved. So we want to make sure the strategy that we have is going to make the biggest difference for your knees in the shortest period of time. What I found in my own knee situation, I had dislocated my left knee 4 times, had tore the ligament in my left knee, had ACL reconstruction. They took out 2 pieces of meniscus. The big thing was, in my mind, I had the surgery and I was going to be able to get back out on the judo mat and be able to compete again. There was a big disconnect. Just because I had the tendons or the ligament fixed in my knee, the meniscus trimmed, didn't mean my knee was normal again. So we have to line up the goal, the outcome that we want with our strategy that we're looking at to get the knee out of pain. And I see many people trip themselves up with the process because it's like, well, if I strengthen the muscles in the leg, I'll avoid surgery. Well, we need to know more about what's going on in order to see if avoiding surgery is in order. Is the surgery just for pain? Is the surgery to repair what's broken or torn in the knee? So we have to ask more questions. The more questions we ask, the better we understand. This is about medical sovereignty for you. Because I see so many people that just take the doctor's word for it. And it's not that we want to ignore what the doctor is saying. We want to take what the doctor is saying into consideration to develop the strategy that's best for you. What's going on with your knee or your knees? Because many people, they're like, oh, well, I'll just get the surgery. I mean, I was guilty of it. I'm not exempt from this. 24 years ago, when I injured my knee, I didn't even want to go see the doctor. It was like the ostrich syndrome. I wanted to stick my head in the sand and not deal with what was going on. I wanted my knee pain just to go away, my knee to be back to normal. It didn't quite work that way. And when I went to go see the doctor, and the doctor was like, yeah, Bill, you tore your ACL. You could do an MRI, but it'd be a waste of money. I said, okay, well, when could we have the surgery? I didn't ask any more questions. I didn't know what to ask. It was like deer in the headlights. And many people get stuck in this situation thinking that the Western medical model is going to provide the be-all, end-all solution for what's going on with their knee. And in many cases, if something is broken or torn, absolutely, I want them in my corner if I need that strategy. But many times people are disillusioned with that process and they get to the other side of the surgery and the physical therapy, like myself. I was still limping, couldn't bend my knee fully. I couldn't straighten it fully. It was swollen. I couldn't, it was difficult sleeping. My hips and lower back hurt. So there is so much more to the conversation, so much more to the equation that goes into getting a knee to feel normal again, no matter what the diagnosis. So I want to pose this as it's important to take this information into consideration. Suzanne says, do I need to get an MRI to know exactly what I'm dealing with before I can move forward? Maybe, depending on, now I went to Dr. Ellis. He was the University of Louisville Cardinals sports team. He was the orthopedic surgeon for all of the athletes for the University of Louisville. So he was all about getting the athlete back on the court. And he did what's called the Lachman's test. And I'm going to spell this Lachman, Lachman's test. I'll post that out there, Lachman's test. So a Lachman's test checks to see if the ligaments in the knee are still intact. We want to see if the knee is mechanically sound, meaning that I would take a step, I would turn the wrong way, and my knee would dislocate. It's a very humbling place to be when you're afraid that your knee's going to give away. So there's the Lachman's test that a doctor, a good orthopedic surgeon, is going to be able to test what's going on. So that's one way of finding out without an MRI, without a CT scan, without an X-ray. If a meniscus is torn, there are there's a study that's out there that they did, a double-blind study that indicated that a torn meniscus, and they did a placebo with just putting holes in the knee as if they had surgery, and the other group just did physical therapy. And after I don't know if it was 6 months or how long of a time after the test, that they had no significant difference in who had pain and who didn't have pain with a torn meniscus. So that's another thing you can take into consideration. Other people have tibial plateau fractures. They will get a fracture in the bone, something going on in the knee, and they need surgery in order to repair that. Once again, making sure you have a diagnosis from a doctor. Really great. Here's a good approach is contact one of your local university or sports organizations local to where you live. So I live a couple hours away from Charlotte, North Carolina. So I would contact the Charlotte Hornets or the Carolina Panthers. That's a football team over there, or any one of the universities, the big universities. We got Duke. We have Carolina University. There's a bunch of them. But I would contact their sports department and ask, who do they use? Who do they send their athletes to? Because that doctor, one, is going to be very busy, and they're not going to mess around with unnecessary procedures. So that was like Dr. Ellis for me with the University of Louisville sports teams. Check my knee. He's like, yeah, Bill, we could do an MRI. It'd be a waste of money. You tore your ACL. Done. Great. I know exactly what I'm dealing with. I had a choice right there on the spot to schedule for surgery the following month, which I did. I don't believe I would be in the place I'm at without having that surgery. So knowing that, getting a solid diagnosis is going to be incredibly valuable in terms of moving forward. If that information makes sense, give the video a thumbs up. Like and subscribe to the Knee Pain Guru YouTube channel. Turn on notifications for future videos. If you have questions, type those in the live chat. I will be happy to answer those questions for you. If you're watching the replay, type those in the comment section, and I will use those on future videos. And for more information, you want to head over to my website, thekneepainguru.com. I have, you could sign up for a complimentary membership to my Knee Club program. I refer to it as Knee Club Lite. So you get a new training twice per week of me working with clients in my group coaching program. It's called Knee Club. And you can check that out by heading over to the kneepainguru.com website. You can also reach out to us directly on our toll-free number, 877-891-9484, and you can speak to one of our friendly team members. And they are friendly. Okay, there are not other questions coming in. I have a video for you I want to play right at the end here, so you want to make sure you hang around for that. Once again, you're watching the replay. Type in your comments, questions, nasty remarks, whatever it is. Let me know because I use that as a feedback loop. What you have going on, where you're at in your awareness of what's going on with your knee and how to get yourself out of pain is directly related to the questions you ask. So if you ask a question, by me answering the question on these videos, it helps other people who also have that question as far as how they can begin to raise their level of awareness on how they can get themselves out of pain. So, okay. Make sure to give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos, and stay here and check this video out. This is Bill Paravano, the Knee Pain Guru, going to sign off for today. Have a wonderful day, and I will see you on this later video this week.